OSCE Station 3 Implementation. As you have seen in our previous videos, we were giving you an overview about OSCE stations, assessment, and planning. Through this video we are aiming to give you insight into OSCE Implementation Station. All 4 stations are equally important when they assess you. However, you need to pay special attention when you perform in this station. So be prepared and be very cautious when you implement. Station 3 Implementation. 9 top tips for OSCE implementation. 1. You need to read the medication administration records, chart louder, and must say what you are thinking about each section. This means that you should be able to analyze and say to the examiner that this medication is due today, the patient has an allergy, the route of administration of medication, and the time of medication administration. 2. You should be able to develop a strategy to ensure that you identify drugs that the patient is allergic to, what the allergy is, and check if the patient is prescribed on any medication containing that allergen. If so, code that medication prior to administering medications. 3. Always remember to check when the patient last had analgesia. What does that mean for this patient at this time? If it is too soon for them to have their analgesics, what would you do in practice? 4. You should be able to explain to your examiner what each drug is administered for. 5. If your given patient is prescribed digoxin, you must make sure of checking the pulse rate before administration of the medication. 6. You should never ever sign the medication administration record until your examiner says that the patient has swallowed his or her medication. 7. Complete the documentation appropriately and get feedback from your peers and trainers. 8. You will have medications to administer in this station, and ensure that you can complete the task within the time frame. 9. Keep in mind that for examination purposes the reason for prescription is not stated on the MAR chart. But this is not considered as a prescription error. 13 key elements for effective implementation. 1. You have to make sure that you have administered the medication for the right time. 2. Make sure that the patient is not allergic to administered medication. 3. Ensure to document accurately the administration or non-administration of medication. 4. You must demonstrate appropriate knowledge of medication administered. 5. You need to make sure to use a systematic approach when checking and verbalizing all drug recordings on the medication administration record. 6. Don't forget to follow all the appropriate checks required prior to administration of medication. 7. Most importantly, ensure to check the person's pulse rate prior to administration of digoxin. 8. You must ensure to verbalize checking of validity of prescription, including the prescriber's signature, dose, route, and time. 9. Always make sure that you do not record or sign the medication administration record before the person took the medications. 10. You need to be careful and should ensure to administer the correct dose of medication. 11. Make sure that you do not run out of time and complete the medication administration record within the allocated time. 12. Check the given patient's identification, name, date of birth, and hospital number. 13. Make sure that you administer medication to your given patient during your time given in this station. If you find our pinpointed presentation useful, please like our video. More precise medical subjects will be uploaded in the coming days. To get the notification, consider subscribing our channel. Visit our YouTube channel for more clear-cut medical subjects. Thanks for watching.